money to the such and such foundation, the disease that killed the individual. They will never say, even though the person may have died in pain, they'll never say give it to the pain foundation, and the reason why they don't is there is none. And the reason why there is none is that everyone thinks of it as a symptom. But in my mind, it is really a disease. And the fact is we now understand the nature of the disease, and it is really a problem of what we call central sensitization. I want to teach you a little bit about that. Another word for it, if you will, are pain memories. Maladaptive memories that the nervous system creates in the setting of injury, and when those memories persist, you end up with trouble, big trouble. Newsweek, by the way, you may have seen, had an article this week on pain, and they talked a little bit about this notion. They didn't use these words, but that's basically what they were talking about. So what I'm saying is that central sensitization is a process whereby when there's tissue injury, you don't just get information that goes to the brain and end of story. You get changes in the central nervous system, in the spinal cord and the brain that enhance the flow of information and make things worse. And those memories last. They can last a long time. If you have nerve injury, it can be worse, because now you're disconnected, you have nerve injury, and the area of the injured nerves start to fire like crazy and send information to the brain, and that in turn produces changes all along the path, and again, central sensitization, long-term changes, maladaptive memories, more pain. Another way to look at it is, if you have a little stimulus, under normal conditions, it produces a little pain. That's acute pain. You might even have an acute nerve injury and may get a little bit of pain. And it goes away. It should go away. But if this process persists so that you get central sensitization and these memories, biochemical changes occurring, an altered nervous system, you now have much more pain. That's the problem that we need to treat. This is the nature of chronic pain. All right? Now, I've focused all about what's happening here, and I've talked about what's happening in the spinal cord a little bit, but I said there's no pain in the spinal cord, right? There's no pain in the foot. Where's pain? That's right. No brain, no pain. This is where pain is. All right? This is where pain is, and we're only now getting a handle on the nature of how the brain generates a pain experience. Because the brain is monitoring all this information. Sometimes it can't do anything about it. I find it fascinating that Dana could take that piece of ice in her right hand and say it's freezing cold and put it here, and the brain knows it's ice, and yet it's burning. The brain could not overcome what was clearly an illusion. Very powerful. It's what it was an illusion. It's not burning, but it's interpreted as such because of the damage, quote, that I had inflicted. So, where in the brain is pain? That's what I want to talk about a little bit. Well, it was asked by Bertrand Russell a long time ago. He was visiting his dentist. Bertrand Russell, British philosopher, kind of a character. And he was asked by his dentist, where does it hurt? Your dentist always asks you, right? And what he said, in my mind, of course. So he understood my lecture. It doesn't hurt in your molar or your incisor or here. It hurts here in your mind, and your mind is your brain. And what I'm going to try to explain is how that comes about. We used to know nothing about it, but remember I told you there's different features of the pain experience. Sensory discriminative, where is it? What kind of stimulus? How intense is it? Well, and then there's the emotional feature. How unpleasant is it? What do I do about it? Why does it motivate me so much? Very different features. It turns out the brain processes things differently. The analogy I like to draw is seen in this. And I show this to the medical students. You recognize this as a Mondrian, Piet Mondrian, a Belgian artist who painted these interesting paintings. This one I think is called Yellow Number 23. Now, your retina, you walk by and your retina sees this. And the information goes to the part of the brain, the visual cortex, and you get a perception that looks like this. Now, two different people. One walks by, just keeps going. You know, where are the Picassos? Where's the Rembrandts? I don't get this. You know, another person walks by and just stop dead in their tracks. Tears, start flowing down. They understand what drove Piet Mondrian to paint this. And they're moved. There's an emotional experience attached to this physical stimulus.